Good afternoon. Thank you very much for the opportunity to share our experience with Sonovein in some difficult scenarios. We all are familiar with the treatments and several options of treatment that we have available to treat our varicose veins patients. We have several options and we are all experienced with all those. However, we could think that if we do need other option of treatment to answer to other difficult cases. In my opinion, we do, because there are some cases, some scenarios that remain challenged although we have all these options of treatment, such as fragile perforators, tortuous anatomy, recurrent veins, deep perforators, that has already been explained, or no access scenarios. These are patients that are unsuitable for catheter-based procedures or surgery. I'm going to share some examples. These are two cases of leg perforators. But one case, the patient had already been doing a previous surgery, and that's still a tributary that was insufficient, that was fed by a perforator insufficient. This perforator was treated, and the patient improved of that tributary. This other lady had a post-thrombotic syndrome with an ulcer, recurrent ulcer, that kept, although she had already done foam sclerotherapy, but kept the ulcer. After treatment of this perforator, she improved and kept with long follow-up with no ulcer recurrence. Other important cases that I think that the advantage of Sonovein is substantial is kind of recurrence with tortuous neovascularization, as we can see it here. This case, we can't do any procedure of procedure-based catheter, and even surgical is complex because this is fibrotic surgery, as we all know that we do surgeries. So I presented several cases of recurrences that patients that have done already several procedures and still kept with the varicose veins, difficult access and difficult resolution, and where you can see that the main focus where Sonovein can help, it needs a really focused pre-planning and book and the marking of all the neovascularization sites and all perforators that are responsible for these varicose veins, and in that case you can achieve a good static result. Although these are long time consuming procedures and you need several times to do several times the procedure, because as you'll see, this is another case, because even with the patients that have C5 clinic, because you'll see here with Sonovein, we can define the patient, the areas that we can treat. And all these areas of the vein we can address and do the treatment. Obviously, this needs several passages, several time-consuming to solve the patients. So in these cases, Sonovein in fibrotic post-surgical tissue and multiple incompetent perforators adds a definite advantage. It allows echo-guided ablation. It permits to do it in outpatient with local anesthesia, and add the special, for me, it's special advantage that opposite to other procedures, it doesn't generate new neovascularization. So for these patients that already done 3-4 surgeries, for them is a major advantage. To finish, just a more complex and important case of Klippel-Trenaunay syndrome also. She had a lot of varicose veins that had already 3 and 4 previous surgeries, and we could see this was the type of neovascularization that she had, no possible to do catheter-based procedures, and after Sonovein, after HIFU, could do the ablation of these neovessels or this perforator of the thigh that was responsible for this big tributary although in this, of course, this patient, we don't want to solve everything, which is impossible, but we want to address the burden of the points of reflux, to solve those and to improve the quality and the appearance of these patients. To finish, just to say that Sonovein is not intended to replace all the previous treatments and methods we have, but it may expand our options when excess recurrence or fragile anatomy makes the conventional treatments difficult. For this, it is important to say that patient selection and duplex planning are essential. Thank you very much.